In 2011, Sebastian Mitzel was a patient at the University of Utah Medical Center. At that center, he was receiving treatment regarding his hemophilia, a condition known to decrease the body's ability to clot blood. While he was at this center receiving medical treatment, he also participated in a gene therapy study. And in this study, they removed a section of his DNA, the portion that codes for hemophilia, and they did this all using the new CRISPR technology. Following his gene therapy treatment, the University of Utah proudly exclaims that Sebastian no longer has spontaneous bleeding episodes and no longer has hemophilia. In this speech, I'm going to talk about gene therapy and how it's so important to us as citizens living in the United States. I'm going to talk about how it can benefit us, our families, and our community, and how we can see it implemented in future medical studies and practices in the near future. Dr. David R. Liu, a leading scientist in genetic evolution, explains that genetic diseases like hemophilia are a result of a simple base pair swap, an adenine for a thymine or a guanine for a cysteine. These simple base pair swaps are known as mutations. And typically in the human body, our body can have billions of these mutations every day with no repercussions to the cellular function. However, if that mutation is passed from a parent to an offspring, or is developed early enough in development, occurs early enough in development, then it could lead to that mutation being represented in the majority, if not all, of our cells. And at that point, it would cause an abnormal function at the cellular level. If this happens to you, then you would be one of hundreds of millions of people with a genetic disease. Genetic diseases are pretty frustrating because for scientists and doctors alike, we understand that there is a specific one base pair swap. We can see that cause for the genetic disease. And in theory, we can see the exact solution for that disease. We just fix the base pair. By removing that base pair and implementing a new and healthy function, we could see the world's greatest preventative medicine ever known. So gene therapy does that. What happens is gene therapy removes that section, the portion that is incorrect, and the body will fill it in with the sequence of DNA code that is normal for a cell function. And therefore, you would no longer have that genetic disease. I believe in using gene therapy, we could increase the quality of life for hundreds of millions of people, all those people with genetic diseases, and their families that have to help with those who have genetic diseases. The National Human Genome Research Institute states that there are 50 genetic diseases which can be related to a specific mutation, one base swap pair. So some examples of a genetic disease with that one base pair swap would be breast cancer, cystic fibrosis, hemophilia, Tay-Sachs disease, and progeria. As far as we know, there are no known cures to these genetic diseases. There are treatments that we can do that help to make people comfortable, and a lot of treatments that we do are treatments to assist the symptoms rather than the disease itself and make people comfortable. Gene therapy is the leading cure for genetic diseases. Furthermore, the American Journal of Medical Genetics states that the leading cause of infant mortality here in the United States is genetic disease. If we can intervene at the embryonic stage of development and go in and change those base pairs before the fetus has developed, then we could really assist in decreasing infant mortality. It's important to use preventative measures when dealing with medicine. Using preventative medicine rather than restorative medicine could lead to an increased way of life, happier, longer lives, decreased financial burden on families, decreased hospital stays, and a lot of other benefits to families and the individual themselves. It's important moving forward that we understand that it is illegal in the United States to operate on the embryonic stage of a fetus, to fix the base pairs before the child is born. And the government does not fund any gene therapy treatments here in the United States, which leads to decreased knowledge on this way of medical treatment. If we can let our voices be known to our elected local, state, and federal officials, we can get our proposal out there and they can know that this is a concern for us as citizens and that we want to see this practice in medicine more regularly. It is easy to contact your state, local, or federal officials. A simple Google search will show a hotline number that you can call or web address where you can enter in your proposal. Catherine Schulz is the writer of The New Yorker, and she states that we are not a voiceless democracy. She gives an example of how our voices can be heard and how we can make a difference. In 1989, she states that Congress tried to give themselves a 50% pay raise, and she gives another example that in the late 2005, Congress tried to pass a bill where fines and prison sentences were increased for undocumented persons in the United States. And in both cases, the people, the citizens, all of these people in our community spoke up against it and said they didn't like it, and it never made it to the Senate. I know that our voices can be heard and we can make a difference. I'd like to see a show of hands of all the people in this room that are willing to contact a local, state, or federal official following this speech and let them know how important gene therapy can be for our future. Thank you so much for your support. Thank you. I want you now to imagine a world where a mother doesn't get breast cancer and leave a family of children behind. I want you to imagine a world where a man doesn't cut his knee and risk bleeding out and dying. I want you to imagine a world where an infant isn't born and ages so rapidly that she dies of old age by 14. For some of us in this room, it may be hard to imagine what it would be like to have a genetic disease or to have a family member with a genetic disease. But I want you to try and imagine a world where there is no one who has a genetic disease. Genetic diseases are incurable unless gene therapy is used. We can treat symptoms, but we cannot treat the disease itself. I hope from this speech that you have gained an understanding of gene therapy, and moving forward, you will talk to your representatives and let them know the benefits of gene therapy in medicine and science. It is important that we, as a community, as citizens of the United States, consider those 100 million people with a genetic disease when we are looking to pursue our science and medicine and where our funding goes. As we progress the United States, I hope that you can no longer have to imagine a world without genetic diseases, but that we can actually start living it. Thank you.